both medical as well as nursing should become more supportive to the idea of reproductive rights. That's where our eventual success lies. This task of engaging with the medical profession and the medical institution is not going to be easy, because medical profession is highly paternalistic in the way it is organized. It's also very hierarchical. You have the topmost people who are the doctors, who are the team leaders. On the other hand, you have also a large number whose job is to do the caring of the patients. Right? So they have nurses. So there is a kind of a division of labor within medicine. And this division actually took place somewhere in the 19th century. The 19th century is very, very important. The industrialization was taking place, science was developing, hospital emerges as a place where people actually go to get treated rather than to die. And the concept of asepsis, antisepsis develops, and all the new things come up. Complex hospitals come into being, and where a division of labor has to be carried out. But this division reflected a division of labor that we find in the patriarchal society. I had often encountered this kind of similes that my professors and others were using, because they were very, very paternalistic towards everything, and they said that we are like parents. So I am the father, and our nurses are the mothering them. They are caring for them. And these patients are vulnerable, they are not so educated, and they don't understand medicine and all. So they're like kids, we have to care for them, we have to ensure that we do good for them, but they cannot decide on their own. So there was no concept of autonomy for the patient. In abortion, I would say that we need to work on the fundamental principle that medical profession, nursing profession, and all of them in the healthcare services should be respecting the reproductive rights of the women. And one of that right is a right to abortion. And if that we are able to convince them about, I think we may be able to have a excellent support from the medical professionals in achieving safe abortion in the country. What worries me is that the women who are entering into the medical field, and as women, they have to work harder to get recognition. Being a woman leader means you have to show that you are as masculine as men, or more masculine than men. Now this pressure on women within medicine to behave in that manner is the one that we need to understand, is the one that we need to help them to fight against, and say that, well, you can be caring and feminine and yet could be the doctor and the leader of the team. That's a different way of practicing medicine, which is a big challenge. And also bridge the gap between medicine and nursing, that curing and caring, there may be a division of labor, but at the same time, they both have a rightful place in the medicine, and both of them have to have at the basis of what they are doing is healing and caring as a part of the profession. So not only for the nurses, but also for the doctor. So this is a long battle, and which will reform the larger medicine. It will also provide a lot of space to the idea of reproductive rights. It will open up medical profession to those ideas.